are you feeling after your surgery? I know I've left you here about 4 hours now, but I had to go pick up the kids from school and help them with their homework.
Hi, Vivian. It's okay. I haven't really been awake.
Well, how's your leg feeling? Have you moved at all?
I really haven't felt anything, but it's starting to hurt a little bit right now.
Okay, let me go find your nurse to see if she can make you feel more comfortable. Hi, are you Diana's nurse?
Yes, I am. I just got here about an hour ago. I've been wanting to check on her, but it's been a little busy. How is she doing?
She's doing okay. She said she's feeling a little bit of pain now. I'm not sure if she's moved at all since surgery. She's in a flat position and doesn't look like the bed is too comfortable.
Okay. Well, if she's feeling a little bit of pain, I'll check to see if she has an order for pain medication we can give her. And then, would it be okay if I meet you in her room in about 5 minutes?
Yeah, that'll be okay.
Okay, thank you. Hi, Diana. I'm Janelle. I am your nurse today. How are you feeling?
I'm a little more awake. My leg is starting to hurt.
Okay, your daughter Vivian told me you were starting to feel some pain, so I brought some pain medication. On a scale of 0 to 10, 10 being the worst, how much pain are you feeling?
I feel like it's a 7.
Okay, so yeah, let's get you this pain med, and then we'll go from there. You're laying very flat in the bed. Let's sit you up so you can take this. Oh, is that okay? Oh, we're good. Is that okay?
Yeah.
Okay, so there's that. Should help a little. All right. So, you just had surgery on your right hip. And we'll want to make sure that you're not having pressure anywhere. So we'll probably start by getting you situated with some pillows because it looks like your feet are just right on the bed. Vivian, would you be able to help me with lifting her legs? I brought a pillow with me that we can put under her legs.
Yeah, of course.
Okay.
She has been having a little bit more trouble recently, even before the fall. She uses a wheelchair, and she did fall off of her bed once, but luckily she had a life alert alarm.
Oh, okay. Well, that's good to know.
Ooh, looks like her heel's a little red.
Oh, that does look red. Diana, I'm gonna poke your heel a little bit here. We just like to check to see if the skin's blanching. But it looks like it's just kind of staying pretty red. So,
Is she gonna be okay?
Yeah, it could be a pressure injury, but if it is, it's a very early stage of one. So I appreciate you letting me know that she's been in this position for a while, possibly. So, bringing her feet up off the bed will help alleviate some pressure. So if this isn't pressure injury, that'll help with healing and preventing any new ones from happening. But I am going to go let your provider know, see if they want us to do anything else. Can you move at all, Diane? Are you able to roll yourself unassisted?
Oh, no.
Okay, just wondering, and that's okay. But I will go call the provider. I'll be back with you, ladies.
Thank you.
Hi, Dr. Mike. This is Janelle. I'm a nurse calling from Yavapai College Hospital. Hi, I'm calling about our client Diana, currently here in room 212. I'm calling about her right heel and what appears to be a stage 1 pressure injury we noticed about 10 minutes ago. Most recent vital signs are blood pressure 125/70, heart rate 75, respiration 16 per minute, oxygen is 96% on room air, temperature 98 degrees Fahrenheit. She appears stable. Diana is here due to a fall she sustained at home yesterday. Was taken to hospital via ambulance yesterday, and today she received a right hip arthroplasty. She has been out of surgery approximately 3 hours. She has a full code and has no known allergies. I assessed her right before this phone call. I found the skin on her right heel to be red and non-blanchable. I want to let you know she seems to be at risk for compromised skin integrity. We will be alleviating pressure off of the heels with either pillows or heel protectors, reviewing her nutritional intake and repositioning every Q2 hours. Is there anything else you would like us to address? Okay, so we will implement the interventions we just discussed and we'll keep you updated with any changes. Is that correct? Great, thank you. I spoke with your provider, Miss Diana. It sounds like as of right now, we're definitely going to keep your heels elevated, so that'll help keep pressure off. It'll probably be a little harder for you to be moving this leg since it's the one you had surgery on, so we'll just want to make sure that we're not causing any more pressure on those bony prominences. I did want to ask you about your diet. What do you usually like to eat during the day?
I usually eat about the same foods every day. In the morning, I have a frozen waffle, and I like instant noodles. I can just microwave those.
Yeah, yep, those are good. So the only thing with those foods is they're a little low in protein. While we're healing and to make sure that you maintain healthy skin, we do want to make sure you're getting that protein in. Are there any other foods that you like that might be a little higher in protein?
No, those are the only ones that sound good to me.
Okay, fair enough. How about protein shakes? Maybe a protein drink?
It depends.
Okay. Do you like Ensure? We have chocolate.
Those sounds good.
Okay. We can start supplementing that if we're finding that you're just not getting enough protein, and we can make sure you're getting those too.
Okay.
So do we have any plans for discharge?
Yeah, so we were thinking that my mom could come live with me now, especially since she's in a wheelchair. I could help her get around and keep an eye on her nutrition. Is there any other tips that you have for us?
Yes, that's fantastic that she'll be able to be with you like that. Yes, so let's go over how we're going to help you, Diana, while you're here, and then we can go over what we can do while you're home with your daughter, Vivian.
Okay.
Okay. So while I've been talking with you ladies, I have been gathering information because we use what's called a Braden scale.
Oh, I was reading about that. Is that where you measure her sensory perception, moisture, activity level, mobility, nutrition, and how much friction she experiences?
Exactly. Yes, very good. So right now, with what I've learned, you're at about a 9, which means that you're at high risk for pressure injuries. You do have a Foley and are using a bedpan right now, it sounds like. So that helps some with the skin breakdown, but we'll want to set a goal to help make sure that we can improve that score and maintain your skin integrity so it's not getting any worse. How do you do at home up until this point? How's her mobility been?
She's pretty much been independent since she's been living alone, even with the wheelchair and that recent fall. But like I said, now she's gonna live with me, so it will be a little bit different. But even though she's diabetic, she hasn't had any skin issues.
Great, that's good. Okay, well, so at this point, when she gets home, Vivian, if you're able to keep an eye on your mom like you did today, if you notice she hasn't moved around in a while, maybe help remind her to do so. Hopefully with physical therapy, you'll be able to do that more on your own. While you're here though, Diana, we want to make sure that you're repositioning at least every 2 hours. So I'm going to put a note in your chart to make sure that staff can assist you with that.
Yeah, and since I saw how you did it, I can help with that as well. I'll be here with my mom.
Oh, fantastic. That makes for a great team effort. So in summary, while you're here, we're going to monitor your labs. We'll talk with the registered dietitian to go over the diet plan we talked about. And our goal while you're here is to get your pain to at least a 3 out of 10 and make sure there's no further skin breakdown or pressure related injuries. And we'll do that with the repositioning and floating of the heels. How does all of this sound?
Sounds so great. Thank you so much for helping my mom.
Yeah, I better get that chocolate protein shake.
Yes, ma'am.